Senate Concurrent Resolution 119 by Senator Hertzberg relative to B.B. Moore Campbell National Minority Mental Health Awareness Month.
Thank you very much, Mr. President. I rise today joined by my esteemed colleague from Los Angeles, Senator Holly Mitchell, who is a joint author on this measure, to present SCR 119. This measure declares June 2016 as B.B. Moore Campbell National Minority Mental Health Awareness Month. B.B. Moore Campbell was a quiet fighter, members, a fighter whose achievements may have not made the headlines, but whose work made a large impact. B.B. Moore Campbell wrote several books on mental illness, including a children's book entitled Sometimes My Mommy Gets Angry, and several New York Times bestsellers. She also founded the Inglewood chapter of the National Alliance on Mental Illness. Sadly, Ms. Moore Campbell passed away in November 2006 at the young age of 56 years. In her memory, SCR 119 aims to bring awareness and attention to those suffering with mental illness every day. I respectfully ask your aye vote and yield time to
Senator Mitchell. Yes,
Los Angeles.
Thank you very much, Mr. President. And I join in with my colleague, the senator from Van Nuys, in recognizing not only B.B. Moore Campbell National Minority Mental Health Awareness Month, but recognizing the courage she exhibited in making this topic a priority for her own advocacy, a priority for the book she wrote, a play she wrote called Even with the Madness, and in her book, 72-Hour Hold. She explored the theme of mental illness in a way that made it acceptable across the socioeconomic spectrum. It made it acceptable for all communities, but particularly for minority communities. She, as my colleague said, was a founder of one of the NAMI chapters in urban Los Angeles, and her putting her name and face and associating it with minority mental health awareness has been so valuable to so many communities across the state in giving us permission to have very difficult conversations publicly when we have family members or perhaps ourselves are suffering from mental illness. She will forever, I will forever be grateful for the role she individually played, but also in lending her name and support to NAMI, which is an organization that will live beyond her in their efforts to support family members and individuals suffering with mental illness. And I'm glad to join with my colleague in sponsoring this resolution and in declaring it Minority Mental Health Awareness Month.
thank you, Senator Mitchell. Senator Bell.
Mr. President, members, as chair of the Select Committee on Mental Health, I rise in strong support of SCR 119. I'd like to commend my colleagues for bringing this important resolution, raising awareness about mental health disparities in our communities of color. This is a very important issue that we have to study on a regular basis, and I know that it's an issue as well for all areas of disabilities and services provided by the state government. I think the competency, cultural competency element can only have one effect, and that's to have better services to our community and more cost-effective, better services. So I applaud all of those, and especially the fine work that has been done by the NAMI and other organizations on advocating for special needs and disparities with communities of color. Thank you, Mr. Chairman. Thank you to our great senator team to introduce this resolution.
Thank you, Senator Bell. Senator Pan.
Thank you, Mr. President. Senators, on behalf of the Asian Pacific Islander Caucus, I also want to thank my colleagues from Los Angeles for introducing this resolution and rise in strong support of SCR 119. The API community faces challenges when it comes to mental health services, such as language and cultural barriers. fact, the CDC has found that the Native Hawaiian and Pacific Islander adults have a higher rate of depressive disorders among all racial groups, about 20%. And it's actually higher for men at 32%. Data from the 1998 to 2001 found that Asian American and Native Hawaiian Pacific Islander children were more likely than white children to use hospital-based crisis stabilization services, suggesting that their mental health needs often go unmet until their condition deteriorates. API women 65 and older consistently had the highest suicide rates compared to other racial groups. I want to thank our good senators for introducing this very important resolution and shedding a light on such an important issue as minority mental health. And I'd also like to welcome many of my constituents up in the gallery who are here and thank them for coming out to support this very important resolution. Again, appreciate the support. Thank you.
Thank you, Senator Pan. Senator Hall?
Yes, Mr. Chair and Senators, as Chair of the Legislative Black Caucus, I rise in support of SCR 119, which proclaims July 2016 as B.B. Moore Campbell National Mental Health Awareness Month. Senators, African Americans are 30% more likely than white Americans to be diagnosed with serious psychological distress, but half as likely to receive treatment. A 2007 study of high school students revealed that African American males were over 1.5 times more likely to attempt suicide than white males, and African American females were twice as likely to attempt suicide as white females. SCR 119 recognizes the need for culturally competent mental health resources and serves to enhance public awareness of mental illnesses in minority communities. I respectfully ask for your aye vote in support of SCR 119 and thank the authors for bringing this resolution forward.
Thank you, Senator Hall. Any additional comment or discussion? Senator Hertzberg, you may close.
Ask for your aye vote and present the guests. When this
Wonderful.
is concluded.
Thank you. Secretary, please call the roll.
Allen. Aye. Anderson. Aye. Bates. Aye. Bell. Aye. Berryhill. Block. Canella. Aye. De Leon. Fuller. Aye. Gaines. Aye. Galgiani. Aye. Glazer. Aye. Hall. Aye. Hancock. Aye. Hernandez. Aye. Hertzberg. Aye. Hill. Aye. Wesso. Huff. Jackson. Aye. Lada. Leno. Aye. Leva. Aye. Liu. Aye. McGuire. Aye. Mendoza. Aye. Mitchell. Aye. Monning. Aye. Morlock. Aye. Morrell. Aye. Wynn. Nilsson. Aye. Pan. Aye. Pavley. Aye. Roth. Aye. Runner. Stone. Aye. Vidak. Aye. Wykowski. Aye. Wolk. Huff, aye. Block, aye.
Please call the absent members.
Berryhill, aye. De Leon, Wesso. Lada, aye. Wynn. Runner, Wolk.
Ayes 35, no 0. The resolution is adopted. Senator Hertzberg?
Thank you very much, Mr. President. This chamber has been full of articulate and passionate voices from both sides of the aisle on the issue of mental health. The former pro tem, Prop 63, his extraordinary efforts. The current pro tem, No Place Like Home, homelessness for mentally affected folks. This is a big issue. It's a big issue, and so many people from here I've talked to care so deeply about it. And today, Senator Mitchell and I jointly authored this resolution. We have a whole host of folks here we want to just briefly introduce you to. But Senator Hall, I think, made the point eloquently when he talked about African Americans and Latinos' underutilization of services, the underutilization of transgender community in terms of mental health services. The facts are profound. They are profound. The issue is huge in its nature, and by virtue of how it is applied in terms of the communities that are referred to in the resolution is more profound. Just as Ms. Moore Campbell would have hoped The National Alliance for Mental Illness works every day to break down the extraordinary stigma of and to provide education on mental illness. Since the organization started in 1979, volunteers from across the country have provided services such as peer counseling and cultural-specific presentations. And more recently, they've launched Mental Health 101, an innovative program for local organizations, which includes training of speakers who share their extraordinary stories of living with mental health conditions. The program has reached more than 600 audience members in California and has given newfound hope for recovery and wellness. Here today with me are, in addition to a number of folks up in the gallery who I met earlier, Sergio Aguilar Caxola, who's the president. Jessica Cruz, the executive director, Juan Garcia, Christina Roop, Denise Lancaster Young, Dawn Brown, Rudy Saceres, Jorge Wong, Toya Davis, Elaine Pang, Harold Turner, Lynn Goodlow, and Benita Council. Everyone, if you can please recognize NAMI and the folks that are here today and give them a big round of applause. Thank you so very much.
Great. Welcome to the National Alliance on Mental Illness.